Jennifer Doggett here from the Rural and Remote Scientific Symposium, and I'm here with Dr. Chris Bourke from the Australian Healthcare and Hospitals Association. And Chris has just been part of the closing panel and is going to give us his reflections on the symposium. And I've also asked him to talk a little bit about some interesting points he made about institutional racism and why that's a really important concept for the health sector as a whole to grapple with. Chris.
Jennifer, it was really great to be at this conference for the last 2 days, to see the energy, excitement and commitment of so many rural health professionals coming together, talking about the issues they face on a day-to-day basis, but also focusing on the big picture, sharing, working together and coming up with some different ideas about how we can go forwards together. One of the things I talked about a lot over the last 2 days was institutional racism. I think many people don't particularly understand this very well as a concept. They sometimes think it's about the behaviour of individuals in an organisation. That's not true. That's particularly about interpersonal racism. Institutional racism is covert. You can't see it. If you go into an organisation, you wouldn't know it was there. The prime marker for institutional racism is poorer outcomes for some people based upon their race. For instance, we heard today that Aboriginal and Torres Strait Islander people are 5 to 6 times less likely to get a kidney transplant and end-stage renal disease. That's a pretty poor outcome. That outcome is clearly a result of the institutional racism of a health system. It's about the policies, the funding, the governance and the accountability of an institution and its failure to incorporate Aboriginal people and Aboriginal perspectives within those frameworks. And that's the essence of what institutional racism is about.
So one of the comments that was made in the panel by, I think, Rob Curry, was that we can't actually address the gap in health outcomes between Indigenous and non-Indigenous Australians unless we include more Aboriginal people in the health workforce. Like, unless we have a workforce that is meaningfully, inclusive of Aboriginal and Torres Strait Islander people, we will always be, fighting a losing battle. Do you agree that, the institutional racism involved in, say, workforce processes, that is, identifying, training, recruiting, supporting Indigenous people to be part of the health workforce is a really important issue?
Having an Aboriginal and Torres Strait Islander workforce, and that includes the full gamut of Indigenous health workers, Aboriginal health workers, doctors, nurses, allied health workers, dentists such as myself, is particularly important in getting better health outcomes for Aboriginal and Torres Strait Islander people. Last week I was in Mount Isa with the Lighthouse Hospital project, an area that services, a hospital that services an area where the population is 26% Aboriginal. Wouldn't you think it'd be really good in a hospital where almost possibly the majority of the work done, given that Aboriginal people have 2 to 3 times the health issues of non-Indigenous Australians, that the workforce at that hospital actually reflected the workload of the people coming in to see it? That would be something that I would like to see, because it's going to enable people to be able to see other Aboriginal and Torres Strait Islander people caring for them and enable them to get better outcomes.
That's great. Do you know what the percentage of the hospital workforce is that is Aboriginal or Torres Strait Islander? I assume it would be less than 25%.
I think it's a couple of percent.
Just a couple of percent, yeah. So there's a big gap there. Unfortunately, the Minister for Rural Health wasn't able to take questions this morning after her speech, but if you were able to ask her a question, and if she is listening to this, what would you ask her?
Well, the question I'd have for the Minister for Rural Health is, what is her strategy to both identify and tackle institutional racism within the Australian health system?
That's a great question, and I hope she's listening and is able to answer that. Thanks a lot,
Thank you.
Dr. Chris Bourke.